So, welcome again. Welcome to this audio-visual discussion. And here we are going to talk about the diuretics and antidiuretics, the drugs which are acting on the nephron. So, first start with the diuretics. And diuretics actually divided into three types: high ceiling, mid ceiling, and the low ceiling as per their potency. So, high ceiling diuretics are two types: loop diuretics and osmotic diuretics. The mid-ceiling diuretics are thiazides. The low-ceiling diuretics are two types: carbonic anhydrase inhibitors, and also potassium-sparing diuretics. So, as anatomical location, in the proximal tubule, the drugs which are acting are carbonic anhydrase inhibitors like acetazolamide, and they are also known as anti-glaucoma drugs. We already have talked they are not that much potent, and they are termed as low ceiling diuretics. Now, coming to the high ceiling diuretics, all of them mainly work in the loop of Henle, and chief of them are the loop diuretics. Most potent is bumetanide, and longest acting is torsemide. Among the other group of these high ceiling diuretics are the osmotic diuretics, and chief of them is the mannitol, which is chiefly used in cases of cerebral edema. But we have to also remember it is actually contraindicated in cases of cerebral hemorrhage. Then comes the distal tubule and the collecting duct. And the drugs which are acting on the distal tubule and the collecting duct, and the first drug which is acting on the distal tubule is thiazide, which is preventing sodium chloride symport. Whereas the loop diuretics are actually preventing sodium, potassium 2 chloride symport. One interesting fact about thiazide is, unlike the loop diuretics which is causing hypocalcemia, thiazide causes hypercalcemia. It is causing hypercalcemia. Other group of drugs which are acting on the both distal tubule and the collecting duct are potassium sparing diuretics, which can be divided into two types. One acting on the ENaC channel, other is aldosterone antagonist. Among the ENaC channel which are working amyloride and triamterene. Amyloride and the triamterene, and those are acting against the aldosterone antagonist like spironolactone, heparin. So till now we have talked about the diuretics. Now we are going to talk about antidiuretics, and chief of them is vasopressin. It acts on the vasopressin acts on the three receptors V1, V2 and the V3, but the chief action is done by V2. Apart from the vasopressin, other drugs that are used as antidiuretics are chlorpropamide, clofibrate, and carbamazepine and amyloride. And one interesting fact is that thiazide can also act as antidiuretics in specific situations. Thiazide can also act as antidiuretics in specific situations like diabetes insipidus. If you like this particular presentation, follow us in the Facebook, Twitter and YouTube. I hope all the important points of diuretics and antidiuretics have been mentioned out there. Obviously, there might be some extra things can be said in the audiovisual discussion F2F, that will be there. But if you like our presentation and if you have any queries, post your queries in the Facebook pages message boxes. Thank you.